The subject of this video is for anyone who might be considering getting a Medicare Advantage plan. You see a lot of commercials on TV by people like Joe Namath and other athletes and celebrities that are trying to convince you to call in to sign up for a Medicare Advantage plan. They sound very attractive. They're going to give you a lot of things. Now, there are some situations where we will recommend that an individual go with the Medicare Advantage plan, but one thing that you need to consider is the mobility of a Medicare Advantage plan. Generally speaking, a Medicare Advantage plan is going to be an HMO or a PPO. It could be restricted as far as the area that you can receive care in to the specific county or counties around where you live. There are some PPOs that have a little bit larger territory, but they're certainly going to be restricted most likely to certain parts of your state. So if for any reason that you can think of mobility as an issue, for example, if you are a snowbird, if you spend a certain part of the year in one state and you spend another part of the year in another state, or if you are considering being an RVer, or if you just simply like to travel and visit family and friends in different parts of your state or different parts of the United States, if you are away from your service area and you need medical care that's not an emergency, you're going to be out of network, and that could be an issue for you. Now, sometimes situations could arrive. This is basically what I would consider a worst case scenario, where a doctor might not know what's going on with you and wants to send you somewhere else, to another city or another state, to see a specialist, or maybe the doctor does know what's wrong, but they also think they can't take care of that in your area and you need to go somewhere else. The idea of flexibility in where you can receive care from can be a very important consideration. If you have original Medicare as your primary coverage and a Medicare supplement, this idea of restriction of choice of providers or service area is completely removed. You can go to any doctor or hospital in the country that accepts Medicare if you have Medicare and a Medicare supplement. So if you'd like to discuss this in more detail, give us a call. We can give you some recommendations, some pricing on the different plans that are available in your area.